brain's a terrible thing to waste, that's what they say, and if you've ever seen the effects of a stroke on an individual, it is tragic. It's horrible. It can be truly the night of the living dead for not just the stroke victim, but his entire family. And this can rob an individual of many years of productive, vital life and can render someone into the state of being an invalid for the remaining years. And it's a horrible problem. It's the third leading cause of death in the United States right now. Third. And perhaps the saddest part of all is that many stroke events are preventable. I say that because of the two types of stroke, ischemic stroke, which is about 83% of all strokes, and hemorrhagic stroke, which is about 17% of all strokes, these are preventable. These are preventable by controlling blood pressure, by taking nutrients in the diet, bioflavonoids and B vitamins and other nutrients that help to protect the blood vessels of the body, by maintaining strong, healthy blood vessels, by maintaining a strong, healthy heart, by maintaining well-controlled blood pressure, making sure that your blood pressure does not rise significantly beyond 120/80, you can reduce the risk of stroke quite dramatically. As importantly are the warning signs of stroke. You know, stroke really doesn't just happen. Stroke happens like all chronic degenerative diseases, even though stroke is an acute event. It's an event that it has been in the process for many, many years. If it's an atheromatous plaque that causes a stroke, such as, instead of a heart attack, you're essentially having a brain attack, where a blood vessel, perhaps the carotids have plaques growing on them, and a plaque breaks off and lodges itself in the brain and robs the brain of essential blood flow, and the brain tissue dies. Well, those carotid plaques are detectable with ultrasound. So you may want to speak with your doctor about having a carotid ultrasound and seeing if you have plaques, and you can control plaques in your carotids just the same way as you control plaques in your heart, by controlling blood pressure, cholesterol, by raising HDL cholesterol, by increasing the amount of niacin to raise your HDL cholesterol, by exercise, by diet, by controlling your blood pressure. The risk factors for stroke can be reduced dramatically. Now, a very reasonable precaution that you should take is the control of blood pressure. And it's easy, it's safe, it's effective. You know, if you go to your doctor and you have high blood pressure, well, maybe you do, maybe you don't. Some people have what's called white coat hypertension, where they see a doctor and they get scared and their blood pressure just spikes up through the roof. So it's important to get many blood pressure measurements throughout the day. Now, how do you do that? Modern technology has come to the rescue, and our friends at Walgreens Pharmacy have this handy little $35, $39 automatic blood pressure cuff. It's very simple. It just goes right on your wrist, like so. You press one button, and there you are. It pumps itself up. There we go. And it will tell me what my blood pressure is in just a few seconds. Very important that you keep your blood pressure arm at the level of your heart. You don't want it high, you don't want it low, you want it right at the level of your heart. And this device will give you a blood pressure reading, 132/81. Heart rate 76, not bad for being on camera. The advantage of this technology is you can take your blood pressure once, twice, 5 times, 10 times a day. You average it out and you'll know exactly what you're really doing, and you can make lifestyle changes in order to lower your blood pressure. You know, I used to have a blood pressure of 155/95, and some simple changes in diet, a little bit more exercise, and boom, it dropped right down to 120/80, right where it's supposed to be. So wishing you a long and healthy life. I'm Dr. Ron Klatz for the American Academy of Anti-Aging Medicine.